Cryptosporidosis. It's actually caused by a protozoal pathogen. So it's not a bacteria, it's a eukaryote. It generally affects waters, natural and recreational, so we're also including pools and spas, not just ponds anymore, or lakes or rivers. Protective cysts formed by the pathogen aren't always killed by chlorination, nor are they always removed by filtration. Oocysts are highly infectious. The reservoir, you've got infected humans and animals, as well as mammals, birds, and reptiles. The transmission route, you're either going to ingest contaminated food or contaminated water. The signs and symptoms, you get general gastroenteritis symptoms, headache, sweating, vomiting, severe cramps, diarrhea. The causative agents are exactly what it's called. It's the Cryptosporidium species. As far as pathogenesis goes, the oocyst is going to be ingested, it reaches the intestine, and it starts to release sporocytes. These are the active cells. They attach to the epithelium, or the lining of the small intestine, then they invade, and they live actually intracellularly. Intra is inside. Once they're inside the cell, they start to reproduce. Treatment. Treatment is supportive care only for the patients. There aren't any antimicrobial products that will effectively target this specific pathogen, but protozoal antimicrobials can be tried in severe cases. It's not necessarily that it's the most effective treatment though. Prevention. Like with everything else, proper treatment of drinking and recreational waters. So cryptosporidosis, as I said, it is a eukaryote, it is not a prokaryote, and you can see it inside the cells here. In fact, if you look at the lining here, see these worm-looking things? Cryptosporidium, crypto, is a germ that causes diarrhea. It's found in fecal matter of an infected person, and it's spread by swallowing water that has it in it. Human-to-human contact with someone who has crypto is also a possibility. The symptoms: watery diarrhea, nausea and vomiting, abdominal pain and cramping, dehydration, weight loss, fever. Symptoms can last for up to 2 weeks. As far as it getting in the water, people that are infected can spread the disease pretty much for several weeks after they've stopped having diarrhea. So they should stay out of recreational waters for at least 2 weeks after the diarrhea subsides, as well as practicing proper hand washing. Now, rotavirus. Worldwide, this is going to be the #1 cause of illness and death resulting from diarrhea. It accounts for nearly 50% of diarrhea cases, approximately 1 million cases in the United States per year, but in the US, they're generally milder than where you see in other places. The reservoir is going to be humans, and it is a fecal-oral transmission. That can be through fomites, it can be through food, it can be through water. Signs and symptoms. You get watery diarrhea, fever, vomiting, dehydration. It can lead to shock, especially in the very young. Babies from 6 to 24 months can have such bad diarrhea, they go into shock fairly quickly. The causative agent is going to be rotavirus. It is a member of the reovirus group. Pathogenesis. The virus injures the GI tract and it damages the intestinal mucosa. Treatment and prevention. For adults, really and truly, you don't need treatment. It's self-limiting. It goes away on its own. But in kids, you do need to have supportive care. So you need to replace the fluids that they're losing. You need to replace the electrolytes that they're losing. Prevention. You can get vaccinated. The vaccination for rotavirus has existed since 2006. So rotavirus looks like this. Clinically, the symptoms can last for 48 to 72 hours. You have myalgia, so muscle pain, malaise, you don't feel good, a headache, watery diarrhea, abdominal pain, nausea, vomiting, and usually a low-grade fever. It is associated with intussusception. What this means is the swelling gets so bad that it kind of folds in on itself and creates a pocket that the rotavirus can basically be housed in. Also, if you're in a house where somebody has rotavirus, you need to keep an eye out for similar symptoms in members of that household. It does spread fairly easily, especially if you got a baby with it. Everybody's taking care of the baby. It's pretty simple to get it from one person to another. The most common cause of severe gastroenteritis in kids is rotavirus. The typical age group is usually between 6 months and 2 years. And again, that transmission is fecal oral. So you can see here the poor baby is just, so bad it's going through his diaper. Staphylococcal food poisoning. In the case of staphylococcal food poisoning, it's actually an intoxication and not an infection. The bacteria makes a toxin and that's what makes you sick, not the bacteria itself. It's associated with foods that are salty or very sweet, cured meats, sauces, custards, things like that. The organism is transferred to a food item. It can be from a handler who doesn't really wash their hands well. And usually when we're talking about Staphylococcus aureus, it's found in our nasal cavity. So it's there. It's just that, again, they're not washing their hands well before they're actually handling food. The toxin is also heat stable. What that ultimately means is you can cook the tar out of this stuff, and while the bacteria will be killed from the heat, the actual toxin will still be there. It doesn't denature, it doesn't fall apart. So you still get sick even though you cooked your food well. The reservoir, it's humans, but normally it's not transmissible from person to person. The transmission route, you ingest the toxin that is in contaminated food, and a single source will typically affect multiple people. The signs and symptoms. This is really rapid onset. Again, you've been given a toxin. It's not the bacteria that has to multiply and make more. You literally have been poisoned by this toxin. So when we say rapid onset, we mean it happens within hours. Violent symptoms, you have cramping, you have nausea, you have vomiting, you have diarrhea, and it is bad. It is like violent to all four of these. The other thing is, because it's a toxin and it's not something that sticks in your body, it usually resolves within 24 hours. When you say you have like a 24-hour stomach bug, this is usually what it is. The causative agent is Staphylococcus aureus, but the toxin is the only thing that causes the disease. The pathogenesis, the toxin is ingested, it attaches to the lining of your GI tract, and it causes symptoms. As far as treatment goes, nothing. It is self-limiting. Like I said, it lasts about 24 hours and then it goes away. Prevention, good hygiene. When preparing foods, good cooking practices. You want to make sure that you're refrigerating items that need to be refrigerated and you are cooking things to their required temperature. If you're not sure, get a food thermometer and put it in the middle of whatever it is you're cooking. Make sure that it gets to the right temperature. And you can easily find those temperatures online. So Staphylococcus looks like this. Remember that staph looks like little bundles of grapes. The staphylococcal toxins are fast-acting. Symptoms, like I said, usually develop within an hour, so 30 minutes to 6 hours. If we were talking about a bacterial infection, that wouldn't happen. It usually takes a couple days here, or even a couple weeks. Here, you're gonna know within a few hours. Patients typically, like I said before, experience vomiting, nausea, stomach cramps, and diarrhea. Luckily, because it's a toxin and not a bacteria that can be passed from person to person, the symptoms only last for a day and you can't really pass it from one person to another. Severe illness from this type of food poisoning is really, really rare. Bacillus serous food poisoning. Yes, the bacillus serous that we are using in lab can result in food poisoning. Like staphylococcal food poisoning, it isn't the bacteria that causes you to get the symptoms. It's actually a toxin that the bacteria creates. It is commonly associated with buffets, which I will explain in just a second, and the reservoir for this is soil. So the transmission route is ingestion of the toxin in contaminated food. Now, the food that we see this most commonly in is food that has been cooked and then kept warm for a really long period of time. What do buffets do? They cook the food, they put it out in the warming trays and wait for people to come and get their food. That's one of the reasons why it's really associated with that. Now, depending on the exotoxin ingested, there are kind of two forms that this comes in. It can be diarrheal, where you've got watery profuse diarrhea, lasts about 24 hours, so it's self-limiting. Or it can be emetic, which means vomiting. Instead of diarrhea, you have a vomiting form of food poisoning. So the bacillus serous produces one of two exotoxins that can actually cause symptoms. So you cook the food to the right temperature, but there are endospores. The fact that there are endospores actually means that when you leave the food in a warm environment for a long period of time, those endospores now have the chance to return to the vegetative state instead of being dead. That's when the toxins are produced. The exotoxin enters the body and it produces the GI symptoms. Like I said, the symptoms aren't caused by the bacteria, they're caused by the toxin. Treatment lasts 24 hours. It's self-limiting. You're not going to treat this. You're just going to let the person go through the process. Prevention: if you are reheating your food, make sure you actually put them at the correct temperature. If you're not sure whether it's at the correct temperature, invest in a food thermometer and just check. It's very simple to look up the right temperatures online. We know this from lab. Bacillus, anatomically, is a streptobacillus bacteria. It's long chains of bacilli. Again, with the symptoms, you've got watery diarrhea, abdominal cramps and pain, nausea and vomiting. It's a gram-positive, rod-shaped, facultative anaerobic bacteria, and it belongs to the Bacillus genus. It causes emetic and diarrheal versions of food poisoning. Again, emetic means that you're going to be vomiting. And usually with emetic, you're talking about consuming things like cooked rice or starchy foods that have been left at room temperature for a long period of time. With diarrheal, this is going to be consumed from meat and ready prepared meals that were pretty much improperly stored, and it causes diarrhea and stomach cramps. It has a pretty high infectious dose, and we already talked about the foods that can be affected. The incidence. Usually this specific type of food poisoning, there are about 64,000 cases that are reported each year in the United States. Mumps. The name comes from an Old English term that means lump or bump, and it's basically used to describe a patient's jaw or throat area. Once the illness is resolved, though, you do have really long-lasting immunity to that virus. There are no long-term carriers. There is nobody who carries this virus for a long time. The reservoir is exclusively humans. As far as transmission route goes, it's contact with salivary secretions. Fever, nasal discharge, muscle pain, and malaise. I'm tired and I'm weak. These are the signs and symptoms. Parotitis is swelling of the parotid salivary gland. That's the one next to the ear that I told you that you kind of get a cramp when you eat something sour. Viral multiplication increases and spreads to other organs. About 20 to 30% of males with the mumps will develop a localized infection in the epididymis and the testes. Now, while it's painful while you have it, it's not usually associated with any type of permanent damage. The causative agent is the mumps virus. It enters the salivary glands, then it multiplies and it invades other organs. Treatment. If you have it, there is no treatment. Pretty much you're going to have supportive care for the symptoms, but you just got to go through the process. Prevention, the MMR. I've mentioned the MMR several times already for measles and rubella. The M in the middle of the MMR is for mumps. Now, while this picture basically, it just looks like a kid with a, I hate to say it this way, but with a fat face, here you can really see the swelling that is occurring on the neck and on the side of the face. This is the mumps virus. Again, as far as symptoms go, you have fever up to about 103, headache, muscle aches, weakness and fatigue, the malaise, loss of appetite, pain when chewing or swallowing. And if you look at this, I mean, how can you not have pain when you're chewing and swallowing? And the swollen glands in the neck. Gastritis and gastric ulcers. Now, something that's kind of cool. Ulcers were once thought to be caused by things like stress and eating spicy foods. But in reality, it was a bacterial infection. So in the 1980s, there was an Australian scientist who found this bacteria in any animals that he was studying that had ulcers. And he came up with this idea that it was H. pylori that was causing these ulcers. Scientists didn't listen to him. So what he did, in the ultimate bid to prove himself right, was he infected himself and his wife with H. pylori. And sure enough, in a certain amount of time, they did actually develop ulcers. The infection itself is usually acquired early in life, and a lot of cases remain asymptomatic for years. The reservoir is going to be humans. It is possible animals, water, or other reservoirs exist, but we really haven't been able to prove that yet. The transmission route is most likely fecal-oral, but again, we're not sure. We know it's there, we don't know exactly how it works yet. So, signs and symptoms. Gastritis. You've got sharp burning abdominal pain. You can also kind of evolve into gastric ulcers where you've got peptic ulcers. Ulcers ultimately are sores or lesions in the mucosa of the stomach, or they can even be in the upper part of the small intestine. This can be accompanied by bloody stools, vomiting, or a combination of the two. So H. pylori itself is a gram-negative bacillus. It enters the GI tract, attaches to the stomach's epithelial cells, and eventually, after being there for a while, remember I said you can be asymptomatic for many years, it will actually damage the lining of that stomach. Treatment. Antibiotics is one thing, and then you add acid suppressors. Imagine having a sore and somebody pouring acid on it. It's probably going to be very painful. So having the acid suppressors actually kind of also helps to heal those wounds. If you keep pouring acid on an open wound, it's never going to have enough of an opportunity to heal. Prevention. While you're in treatment, do avoid aggravating the condition through spicy foods or stress. So this is H. pylori, and again, you get abdominal pain with burning or a gnawing sensation. The pain is often made worse when you have an empty stomach, and nighttime pain is fairly common. You have a poor appetite. You will usually, because you have a poor appetite, experience weight loss. Heartburn, indigestion, also known as dyspepsia, belching, nausea, vomiting, and again, if it's bad enough, you'll see blood in the stool. So H. pylori, because of the damage that it causes to the cells in your stomach lining, can actually increase your risk factor of gastric carcinoma for stomach cancer. They actually do synthesize an enzyme called urease, which produces ammonia. That actually is one of the things that damages the gastric mucosa. The ammonia will also neutralize the pH of the stomach. So ammonia is very basic compared to the very acidic hydrochloric acid that's in your stomach. When it neutralizes it and it's not so acidic anymore, it really does make the perfect environment for H. pylori to stick around in. If you are going to treat ulcers, you can use omeprazole, you can use clarithromycin, and you can also use amoxicillin. Hepatitis is a general term for an inflammatory disease of the liver. Hepo or hep means liver. So hepatitis is pretty much inflammation of the liver. The key characteristics are going to be necrosis of the liver. Necrosis is death, so you've got liver cells that are dying. Swelling of the liver, disruption of the structure of the liver, disruption of the function of the liver. One of the biggest functions that we have for our liver is making bile pigments, so you'll see interference with that. If somebody has really bad hepatitis, you will see jaundice. We saw this with the yellow fever, with the yellow eyes, and the skin was kind of yellow. It's a yellow coloration of the skin and eyes due to bilirubin, which is a type of bile pigment, accumulating in the blood and the tissues instead of being used by the liver because the liver is damaged. It can be caused by a variety of viruses, and it can also be caused by non-infectious conditions such as autoimmune disease or alcohol abuse. But in this case, the way that we're going to talk about it, we're only going to discuss the viruses because this is microbiology. So hepatitis A and hepatitis E. Both of these are associated with unhygienic food handling, eating shellfish harvested from fecally contaminated waters, or eating produce that has been cleaned with contaminated water. Hep E can cause complications in pregnant women. As far as the reservoir goes, it's humans. The transmission route, fecal oral. Typically, again, we're ingesting something that's contaminated, either food or water. There have been some cases that show that it can be transferred by blood or blood products, but really and truly, when you compare the two, it is really rare for that to happen. Signs and symptoms, usually with A and E, it is subclinical. Symptomatic cases don't really have, this is what this is. The symptoms are very vague. They're kind of flu-like. In more severe cases, though, you will see jaundice, and if you do a scan, you'll see that the liver is swollen. In this case, both A and E are not oncogenic. They don't actually cause cancer in the liver. A and E are both RNA viruses. As far as treatment goes, there isn't a treatment. There's none. Infections are self-limiting, but you can give the person inoculation with an immune globulin. It does offer passive immunity. I'm giving you antibodies against them. As far as prevention goes, there is a vaccine available for Hep A that is also protective against Hep E. So Hep A, like I said, it's an RNA virus. As far as symptoms, it can take about 2 to 3 weeks for them to show up. There is no specific treatment, but as far as transmission, it's contaminated food or water. With Hep A, we do have a vaccine though. Hep E is also an RNA virus. Symptoms can take about 40 days to show up. The only weapon we really have is prevention. Transmission, again, contaminated food or water. And as far as Hep E goes, there is not really a vaccine, but for some reason the Hep A vaccine kind of helps. Now, hepatitis B and D. If you're a healthcare worker, this is a major concern when it comes to needle sticks. Primary reason being that even a teeny tiny amount of blood can have huge numbers of virions in them. One of the consequences of that is that healthcare workers are required to be vaccinated against these two. Viruses can be very hardy and can survive for days in dry blood. We're talking 7 days of survival in a dry droplet of blood if these are present. The reservoir is humans. The transmission route is through blood or blood products. It can also be sexually transmitted because there are numbers in both semen and vaginal fluid. The signs and the symptoms include fever, chills, malaise, anorexia, you're not hungry so you don't eat, abdominal discomfort, diarrhea, and nausea. Symptoms are actually the result of damage to those liver cells, to the hepatocytes. Now, Hep B is oncogenic. It can result in liver cancer. Patients co-infected with Hep B and D usually show a more severe presentation of the disease. Something that's interesting, Hep D cannot cause disease by itself. It is either partnered up with Hep B or nothing happens. In the case of B and D, they are both DNA viruses. So Unlike Hep A and E that are RNA, these guys are DNA viruses. The viruses enter the body through a break in the skin, needle stick, mucous membrane, or injected into the bloodstream. It reaches the hepatocytes, the liver cells, it multiplies, and then it continuously releases viruses into the blood. This is one of the reasons why we have tons of virions in the blood, because it's basically continually dumping them in there. So treatment. Immune globulin can be given to people who've been exposed to try and give an immediate protection. So like a rattlesnake bite, you can immediately give them antivenom. You can give them the immune globulins. Mild cases are usually managed with treatment of the symptoms and supportive care. Chronic cases, the ones that are ongoing, can be controlled by a variety of antivirals, but no matter what you're doing here, nothing is going to cure you. You have it, you have it. Prevention. Now remember what I said, Hep D can't infect without Hep B being present. We do have a vaccine for Hep B. That is huge because it means if you get this vaccine, this can't do anything either. So Hep B, DNA virus, transmission through blood or body fluids, so blood or sexual contact. Symptoms, it takes about 2.5 months to show up. The virus can survive up to 7 days in the environment. Remember I said it's really hardy, but there is a vaccine available. 90% of people will recover within 6 months with the vaccine. Hep D, only in the presence of hepatitis B does this work. It is a DNA virus though. Again, 2.5 months to show up. There are no cures. The only weapon we really have is prevention, blood or sexual transmission. And again, there's no vaccine. But since you need Hep B, if you're vaccinated from Hep B, Hep D can't do anything. And finally, Hepatitis C. This is sometimes called the silent epidemic because of the high numbers of Americans that are infected, but they're completely asymptomatic. They don't show any symptoms. Liver failure from hepatitis C is actually one of the top reasons for liver transplants in the United States. The reservoir is humans, and as far as Hep C goes, it's transferred through the blood. The characteristics are very similar to HBV. You've got fever, chills, malaise, anorexia, abdominal discomfort, diarrhea, and nausea. The symptoms again result from damaging your liver cells. Something else though, kind of like Hep B, Hep C is oncogenic. It can lead to liver cancer. Hep C is more likely to form a chronic infection than Hep B. Hep C is an RNA virus, and it's in the family Flaviviridae. The virus enters through a break in the skin, a break in the mucous membrane, or injection into the bloodstream. It reaches the liver cells, it multiplies, and it continuously sheds virus. Treatment. There are several antivirals targeted to that viral life cycle, but really and truly, it doesn't cure, it just treats the symptoms. So it lessens the symptoms. As far as prevention goes, Hep C doesn't have a vaccine. How do we prevent it then? Well, you avoid blood products. So here's Hep C, our RNA virus. Again, transmission through blood products, even poorly sterilized medical equipment can transfer this virus. Symptoms will take about 2 to 6 months to pop up. 80% of people, like I said, it's called the silent epidemic because about 80% of people have no symptoms. It's treated with antiviral drugs, but there is no vaccine. Now, looking at them side by side, A and E are the only ones that have anything to do with food and water. A can cause severe liver damage or even death, but it doesn't cause cirrhosis or liver cancer, and there is a vaccine available. Hep E, same thing. It can cause liver damage or death, but it does not cause cirrhosis or liver cancer, and there's a vaccine available. B and D are linked. So in this case, it can be transferred through the process of birth, through blood, or unprotected sex, which actually is true for B, C, and D. Also with B, C, and D, they can cause liver cancer and they can cause cirrhosis. So they can actually change the way that the liver is functioning by changing its structure. Mother to child transmission is the most common cause of chronic infection, but again, B has a vaccination. D only happens if B is present as far as infection goes. So if you get this vaccine, you prevent hepatitis D as well. Hepatitis C, transmission through the blood route, and unfortunately with Hep C, there is no vaccine available.